Здравствуйте, меня зовут Григорий Мальцев, я буду модерировать.
Hello, Grigoriy Maltsev. I am going to moderate keynote speech of Karen Lee, Fit Cities, Prevention of Non-Communicable Diseases. So in cities, this is one of the main focuses of global health, and architects and planners are fighters for healthier lifestyle. And Karen Lee, associate professor, is studying this problem, and she's going to speak about it. Karen, the floor is yours.
Thank you, Gregory. I'm going to share my screen now so you can see my slides. Share screen. Okay. Gregory, can you see the slides? Okay, I'm assuming everyone can see my slides.
Yes,
Gregory, you'll let me know if, yeah, you can see it?
Yeah.
All right. Well, thank you everyone for joining me today. I want to thank Moscow Urban Forum for inviting me to talk about the role of fit cities and prevention of non-communicable diseases. I was going to say, for some of you who may have attended the last session, the International Dialogue on Active Designing, Maintaining a Healthy Lifestyle in a Mega City, you'll have seen a few of the introductory slides, but for those who haven't, I need to present them again, just so that there's a little bit of background on what the evidence and the data is showing us. So I want to start by showing our priorities for today. As you could see, if you look at global health priorities in the 19th and early 20th centuries, many of our cities were faced with issues like cholera, tuberculosis, infectious diseases that were the leading causes of death. Maternal and infant health, maternal infant mortality, for example, was also very high. Safety issues were also really important. In many cases, we didn't have a lot of safety standards that have been introduced since and that have really helped us to address previous issues of the past. So, how did we actually address many of these issues? So issues like cholera, we actually addressed by actually looking at how we built our cities. The infrastructure in our cities, like having good sewage systems, introducing safe water, even building ventilation and having windows in buildings became standards that helped to allow light and air to circulate to address, for example, respiratory diseases. So these introductions of healthier infrastructure in our buildings, our city streets, our neighborhoods, really helped us to address many of these issues. Today, we've got actually a different set of diseases. Chronic diseases like heart disease and strokes, cancers, diabetes are now the leading causes of death. Mental health issues are leading causes of disability around the world. We have aging populations. We have climate change and environmental pollution. Of course, we still have emerging infectious diseases, like, for example, COVID-19 that we're being faced with right now. It is important to note, though, that if you look at the current infectious disease landscape, even issues like COVID-19, or, for example, every year we know that many people suffer from and even die from influenza, that these underlying chronic diseases and our aging populations are actually really key risk factors for mortality and for severe infection from these diseases. And so they're not unlinked, but rather they are actually linked together. So as I mentioned, the leading causes of death today include and are non-communicable diseases: heart disease and strokes, cancers, diabetes, chronic lung disease. They are now the #1 cause of death globally, 41 million deaths per year, or over 70% of deaths. And many of these diseases are actually preventable. You know, we have preventable risk factors like tobacco use, physical inactivity, unhealthy diets, harmful use of alcohol. These in turn are linked to things like high blood pressure, overweight and obesity, having high cholesterol, or if you get cancer, also cancer-associated infections. Because of these high burdens of illness, these are also underlying diseases for severe infections from issues like COVID. And so if we cannot bring these types of issues under control, they put us at increased risk of severe infection and mortality from issues like COVID. Of mental health issues globally now. About 350 million people every year are affected by episodes of depression. That's about 1 in 20 people every year. It's a leading cause of disability worldwide. And you could see that in WHO report from 2012, they actually talked about some of the effective approaches in the community for preventing depression. And they include programs like exercise programs for the elderly. And that's because these types of programs can provide both a way for the elderly and for people to socialize, but also physical activity has increasingly been found to be protective against mental health issues like depression and anxiety. I also want to bring up that social factors like social isolation are also extremely important, not just in mental health issues, but also in physical health issues. So for example, if you are socially isolated and you lack social support from friends and family, you are more likely to have worse outcomes with physical health issues like diabetes, high blood pressure, arthritis, lung disease. There are studies that show that if you are socially isolated, your risk of getting a first heart attack could be increased by 50%. And so social issues are important in both mental health and physical health, and physical risk factors like physical inactivity, unhealthy diets can in turn impact both physical and mental health. Work stress is another social factor that we are seeing around the world. So, you know, if you have job insecurity and precarious employment, that has adverse effects on both mental and physical health. Stress at work can increase your risk of getting heart disease, not just mental health issues, but heart disease by 50%. There is consistent evidence now that job stress caused by low control at work, low control around the conditions at work, at having been poorly rewarded when you have a high effort job, that these are risk factors for both mental and physical health problems. So what can we do about that? Well, the evidence is showing us that in fact, we can do quite a bit. You know, there are now many studies that show that if you design a community well, so for example, you place residential areas near to recreation areas so that people have access to you know, parks, playgrounds, exercise areas, but also to jobs, to schools, to stores. You connect them by good sidewalks and pedestrian paths. You make sure that the environment is safe from crime and also safe from traffic. That you make the environment appealing through nice landscaping, but not so much landscaping that it obstructs views and causes danger. That, you know, you could shape these things through zoning policies, through building codes, government policies, and even builders, private builders' practices. That when you do those things, these are associated with an over 160% improvement in physical activity. You can also at the same time decrease social isolation and increase people's sense of community. And it can also be associated with reductions in crime and stress. So if people are out and about walking because they're walking to get to neighborhood areas, they're more likely to run into their neighbors and be less socially isolated. They're more likely to be looking at what's going on the streets. There are more eyes on the streets, and that can help with reductions of crime. Street designs can also complement community designs. So, you know, things that improve safety like lighting on the streets, where you can cross the street safely because there are infrastructures to do so. when you calm traffic, particularly where there are pedestrians, through speed bumps and traffic circles, if you enhance landscaping for both safety and aesthetics, these types of things are associated with increased physical activity of 35%, increased sense of community, decreasing social isolation, and reducing crime and stress. So these are basically based on studies that have been done. Our building designs are also important. So, simple signage at points of decision, outside stairwells, next to elevators and escalators, that actually encourage people to take the stairs for health or other benefits. For example, environmental benefits, like this New York City sign that says burn calories, not electricity, take the stairs. Those have been shown to be associated with a 50% increase in stair use. For very high-rise buildings, you can reprogram elevators to stop at every fourth floor, for example, except for one elevator for people with disabilities. And those types of buildings have been shown to increase stair use by over 3,300%. You can make stairwells more pleasant through music and art, more visible when you walk into a building. And there are now materials like even fire-rated glass that you can use on doors and the walls of stairwells safely. And natural lighting has also been shown to increase stair use. Food environments, very important. If you have access to healthy food through supermarkets, for example, and grocery stores, those are associated with lower rates of neighborhood obesity and better nutrition in neighborhood residents. Conversely, if you have high densities of unhealthy foods like fast food restaurants, those are associated with unhealthy weights, obesity, and poor nutrition in neighborhood residents. You could do things also in food retail. For example, removing trans fats in restaurant foods, labeling the menu and menu boards with things like calorie information or sodium information. Those types of things have also been found to be helpful. Community gardens, so not only do they provide an extra space for people to socialize, to get physical activity, but there are some studies showing that exposure to community garden in both adults and children can increase people's fruit and vegetable intake, and access to safe tap water as well. There's been studies showing that, children in poor neighborhoods, for example, in Germany, when schools ensured that there was safe tap water for the kids to drink, that over time, those schools had reduced risk of overweight in their children compared to other schools that didn't do that. I also want to mention that there are many benefits beyond health when we build more active and healthier communities. So in this book called Active Cities, a Guide for City Leaders that I was involved with, the first section actually documents all of the different benefits that have been shown in studies, from safety benefits like less crime, environmental benefits like reduced pollution, social benefits like better social cohesion, decreased social isolation, and even economic benefits. For example, increased retail sales, creation of jobs and job growth by using healthy infrastructure to do that. So you can read all about it in this guide if you're interested. The second section of the guide actually gives some how-to processes, and the third section actually has some case studies and resources. Some of the how-tos can also be captured through the case studies, and I'm going to talk a little bit about the case studies here. So some case studies from the US and from Canada that I've been involved with. So, prior to my returning to Canada now as an associate professor and director of the Housing for Health project, I was in New York working during Mayor Bloomberg's years. And I was their inaugural director of healthy built environments and of active design. And I also was the deputy to the assistant commissioner for chronic disease prevention and control. And some of the environmental and policy approaches that we took were integrating health and well-being right into master plans. There are other cities like Philadelphia that have also done that. One of the ways to do that is to ensure that whenever you're creating a new development, whether that's a neighborhood development, streets, or buildings, or you're doing major renovations of those infrastructures, that you integrate the promotion of physical activity, healthy food, and beverage access right into them. Even your buildings, right? So for example, you can adopt guidelines that are available, active design guidelines. There are now green building certification credits like the LEED Design for Active Occupants, which is a special credit that promotes physical activity in building and building occupants. There are site transportation credits, active transportation credits, like for bicycle storage, etc. LEED for neighborhood development was developed in conjunction with health stakeholders. I was involved in that consultation, for example. There's also new certification systems for health and healthier buildings and communities like WELL. And so there are these guides that you can integrate right into the process for all developments that you're using. If you're a private sector firm, a development firm, a planning firm, you can integrate these guides right into your process of working with clients or when you're developing your own developments. If you're a city and a city official, you can ensure that staff are trained and integrating these health-related elements right in. Administrative policies. You can ensure that your administrative policies includes the use of these guidelines that promote health right into your policies. Considering vulnerable populations is very important. So for example, we have aging populations in many of our cities who may need more help getting around for mobility and social factors. And access to healthy amenities nearby and near their homes is a really important one for helping them stay healthy and staying in place in their homes for a longer period of time. Low-income populations as well may not have the economic power to purchase some of these amenities. And so integrating the amenities like exercise facilities right into affordable housing or into low-income neighborhoods in our public parks are ways that we can do this to increase access. Now, there were a lot of concerns when we were working with affordable housing in the US, in New York and San Antonio and Atlanta, that integrating in healthy criteria and healthy guidelines would actually cost a lot more. And so we ended up doing a study that integrated the health, affordable housing, and developers in these three cities. And we found that, there were a whole list of items that could be done actually very inexpensively and also very feasibly as we talked to the developers. They included integrating in recreation spaces, even rooftop farms, and even integrating right into requests for proposals for new developments, scoring criteria that used health guidelines. In New York, we also had an initiative called Fresh Food Retail Expansion to Support Health, where my staff, city planning staff and economic development staff worked together to create a series of zoning and tax incentives to create and expand supermarkets in our poorest neighborhoods that had the lowest access to grocery stores. And what we found was not only were we able to increase the number of grocery stores providing fresh fruits and vegetables, but also create new jobs in those poorest neighborhoods. And also new fruits and vegetable cart permits, again, in the neighborhoods that had the least amount of access to healthy food. So here are some of the cities I've worked with in the United States. New York City, when I was there, we were given a grant to mentor 14 other US cities. And you could see that in all cities, planning and public health worked together. They had to make these changes happen in our environments. Transportation was also involved in many of these cities. Education and school construction, parks and recreation, public works, housing development, and also sometimes the buildings department was brought in because of building code changes that were needed. Successes from this. So in New York, in less than 1 decade of doing this work, we reversed childhood obesity trends. So while childhood obesity was going up in many other cities, we turned around these trends. And, two of our mentee cities, Philadelphia and San Diego, by taking this comprehensive environmental and policy approach, a healthy cities approach, also was able to do that. We increased bicycle travel, which was good for the environment and good for health. And because of good designs, we were also able to decrease traffic fatalities by about 30%. Transit ridership increased by about 11%. Air pollution levels decreased at the areas that we pedestrianized. No physical activity at all in the last 30 days showed a significant decline after showing no change in the last decade. And within 1 decade, we were able to increase life expectancy faster than in the rest of the US in New York City. There were positive economic outcomes as well. Retail sales increased, retail storefront vacancies decreased, where we pedestrianized and where we improved transit and bike lanes. And as I mentioned already, even created jobs to supermarket development in our poorest neighborhoods. Some of these stories are documented in my book, Fit Cities, if you're interested in learning more. Also, every year, not this past year, but usually most Junes, and we're hoping to start up again in 2021, I offer a 2-day course at Columbia University in New York, where we go out to see a series of these things that have been done. For example, in New York, we meet with the folks from different departments that were important in helping to implement these initiatives so that you could hear how it's done. So if you're interested, please check those out. They're available on my website, drkarenlee.com. I also wanted to mention briefly initiatives in Canada, like the Housing for Health initiative that I currently run. We've got this multi-sector partnership working group of over 100 partners, pilot developments, community engagement. We do research and evaluation of health impacts. And we will have our first annual conference this February 24th, and it will be virtual, called Fit Cities, Fit Towns, if folks want to join. We also are working on a set of healthy community guidelines to guide healthy practices at the building, street, and neighborhood level. This will represent an update from our 2010, the active design guidelines that I worked on in 2010. That's like over a decade years old now. And so we are working on these new guidelines, and they should be available for people who are interested in 2021 as well. I think I'll just mention that pilot developments are also really important, because pilot studies help us to show what's feasible in the local context and to share with others as well. So, one of our pilot developments, you could see on the pictures on the left, we actually, during COVID, the developer was able to bring in a mobile farmer's market to give increased access to his elderly residents to fruits and vegetables. And then, the neighborhood also has parks and trails. I mentioned the conference already. If you're interested, please contact me. We will have keynotes who are international on both the public realm and design and planning, and also social connections. And as I mentioned, for more resources, you can also check out my website and the book. I think that's it. I want to thank everyone for joining today, and feel free to contact me as well at my email.
Thank you, Karen. Now we have time to talk. Thank you so much for your presentation. It was deeper than the one before, and it's great. And the first question or topic that I will like to discuss is that the guidelines that you've mentioned, they can be also used during renovation programs, right? Because in Moscow there is a huge renovation program which will affect many people. And do you see examples when construction or reconstruction of the buildings is being made with health in mind?
Yeah, absolutely. I think, I know that when I was in New York, for example, and now I'm in Canada, but we are looking at renovation as a major opportunity, right? You're going to be spending money to make those buildings better. And now, we can integrate in evidence-based designs and amenities that we know can help to improve the health of folks who are going to be spending time in that buildings, whether they're worksite buildings or they are home buildings. Yeah, because many of our cities, as you mentioned, Gregory, they're built, and so if you have a city that's older and has built infrastructure, you're not necessarily going to be doing only new construction. You're going to be doing major renovations. And as I mentioned, there are now materials that can be used. So, if you're renovating a building and you're not going to, even if you're not going to move around, for example, your stairwell, there are opportunities to make them more visible, more safe through available technologies now. So examples of new available technologies include fire-rated glass. So it used to be you can't really put a lot of glass on fire-rated stairwells because that glass may explode. But now with fire-rated glass, it can actually withstand fire for a long period of time, and so they're safe to use in a lot of building codes. The other is there are new technologies for winter cities, right? For sidewalks, where you could have heated sidewalks that don't have to be cleared in the wintertime. Because of course, ice and snow can present barriers for vulnerable population groups like aging populations walking outside on the sidewalk in the wintertime. And so, but there are new technologies as we renovate that we can utilize. If you are renovating and the pipes, right, the water pipes, as you pull up those pipes, as you open up the streets to do those pipes, those are opportunities to bring onto the street or into your parks and public spaces new drinking water fountains. So we're not asking you necessarily to break the road to bring up those new water fountains, but when you're actually doing new renovation construction work anyways, those are opportunities to integrate in these healthy elements.
Okay, great. Thank you for such a broad answer. Another thing that was bothering me is that, well, let's step back to the COVID situation, right? Of course, we've noticed bad outcomes for the economy and for mental health, and because of isolation and lack of contact, right? But the problem with mental health and built environment exists before. And can you please enlighten a bit on that, and how actually can we change stress and pressure that city puts on citizens through some interventions or active design?
Yeah, so clearly, during this time of COVID, it is absolutely critical, that we practice, issues like physical distancing in order to prevent the spread of COVID. But while we're trying to keep citizens safe, you are pointing out that there are some unintended consequences that we're starting to see, like poor mental health issues, but also, from lack of physical activity. So, with people not necessarily getting the exercise that they used to get, and even particularly vulnerable populations like seniors, whose health, physical health and mental health can decline very quickly. So, when I talk to geriatricians who are taking care of older patients, for example, or physicians who see a lot of older patients, they are telling me that, they are seeing patients who used to be older but very strong, getting now very physically weak because they're not getting enough physical activity and they're socially isolated. But, there are ways that we are seeing that in cities, that cities are taking on to try to ensure that people are not socially isolated while they're physically distanced. So some examples are, in many cities now, for example, in Canada, there are cities that are, if the sidewalk is too narrow and there aren't enough space for pedestrians to safely walk on those sidewalks, they are opening up, for example, an extra lane. So they're taking an extra lane from the car road and actually blockading it and opening that up for pedestrians to spill onto. So that allows for people to continue to walk to places, especially if they can't drive or take a car anymore. Another is, people could use that for walking for recreation. They can use it as a space where they could safely walk outside and maybe meet their neighbors and see their neighbors when they're outside safely in a physically distanced way. So there are things that can be done to increase physical activity and social connection while safely physically distancing. And we're seeing cities do that. More cities could potentially be doing that and also upkeeping that.
Okay, okay. And you just mentioned elderly, right? And I was wondering, well, if we're focusing on developing active urban space, active built environment, it seems that it's important for people who haven't got any uh, non non-communicable disease, like burdens that will be with them their whole life. How
Yeah.
actually active environment is also important for the elderly, or is it more important for those who are still healthy and young?
It's actually important for all. I think, as you pointed out, Gregory, when we had our chat yesterday, that, children, I mean, I didn't have time to go into all the different settings, right? But, I talked about vulnerable populations like low income neighborhoods and affordable housing and, neighborhoods that might have a lot of seniors and elderly. But you're absolutely right. Our workplaces need to be looking at how they can be healthier for our adult populations and working populations, including the younger and healthy populations, because we can prevent them from getting sick in the first place. Children, right? We are increasingly seeing conditions like high blood pressure, even type 2 diabetes that didn't used to exist in children, didn't used to be seen in children, in younger and younger kids. And that is because of the childhood obesity epidemic that we're seeing around the world. So daycare environments, school environments, and their policies around healthy food, around physical activity are also absolutely essential. How we design those buildings, how we design the neighborhoods in which we place schools and daycares, so that, for example, kids can walk or bicycle to school, not only be driven to school.
Okay, thank you. I guess I have one more question at least. At the session before and this session, we're speaking a lot about evidence, how urban health is based actually on evidence because it has to be convincing. And my question will consist of three parts. The first one will be actually how, in a situation when we don't have enough evidence at the moment, how can we generate evidence before we take actions, or how can we get evidence more visible because it's not, for example, that widespread in Russia? And how can we convince the decision makers which data is best and which ways to show it are the best? And also,
Okay.
who is the best recipient?
Well, as you can see, there are so many sectors who need to be recipients, right? Because, for example, there are folks who are building buildings, like our architects, but the developers are their clients, or the building owners. So both of those sets of folks need to get the information. There are urban planners who work for our cities, but also urban planners who work for private sector firms that might help developers doing a larger development. Our city officials and municipal officials need to hear about the evidence, right? At the same time, though, the people in health who might know about this evidence, we need to work closely with city officials, with our planners, with our developers, with our architects, with our, school builders, with our affordable housing and housing builders, because you guys know also, like in the local context where you're in, what are the building codes, the zoning policies that will allow us to do the things that we need to do? Or you might be able to identify as well the zoning policies or the building codes that are currently barriers that maybe we need to work together to improve. So that's one issue about like the who needs to get this information. I think many different professions and sectors need to get this information. Now, in terms of the evidence, there is already, as you heard, Gregory, a lot of evidence of the things that can be done. So in the Healthy Community Guidelines that I mentioned that we're working on right now in Canada, that will be available for use because it'll be an electronic document. We are looking at, what are the strategies that the latest evidence is telling us about? But we are also going to identify strategies. So we are working to create those guidelines, not just in health, but also with people in planning and development, municipal officials, even community residents who are involved in their communities in reviewing, for example, development proposals that come to their neighborhood. These folks are giving us inputs on things that they want to see in the guidelines. And so some of those things are not yet going to have evidence. And so one of the things that we're planning to do with the guidelines is to highlight the things that have different levels of evidence, but also identify the strategies where more research might be needed to get evidence. So what that means is, for those strategies, when you are going to use those strategies, if you're using it in your own project in the future, you should be thinking about, can you partner with a health researcher in your city? Or, like we're working internationally now with groups like ours, like mine, researchers who can actually evaluate these innovations that you're doing to generate the next level and the next round and next generation of evidence as well. So does that answer your question, Gregory? I don't know if I answered all the parts.
In general, I would say yes. Yes, it is. Well, Karen, I guess that's it. We ran out of time, unfortunately. I had the pleasure talking to you, and I hope that as well as our audience has pleasure listening. Just to summarize a bit, I hope that all that officials, developers, etc. will hear that they need to gather interdisciplinary teams and to try to share their expertise with each other. And I hope such conversation will happen more often. Thank you so much.
And Gregory, as people are thinking about how can I do this, you could read the Fit Cities book, the Active Cities Guide for City Leaders book. Those could be helpful. The Healthy Community Guidelines hopefully will be coming out soon in 2021 for everyone who wants to use it. And Gregory, if I'll share with you as well the February 24th Fit Cities, Fit Towns virtual conference. In case you're able to share it with attendees and other people want to join.
Sure. Thank you so much.
Thank you for inviting me.
Thank you. Bye.